Over 100,000 people die every day of aging diseases. We actually treat aging as a disease, and there's a bunch of pathways to aging that we're targeting. You have a whole slew of genes that are actually turned off. We're just changing how the genes code in your cell at a very basic level. It's an injectable and it's done. Okay, there's 44 million people this year with dementia, and that comes in at $608 billion cost annually. The big killers are cancer, heart disease, nephropathies, that means kidney failure. A third of the population will die of heart disease if we don't change medicine now. We can do it at a fraction of the cost and actually produce a cure that the insurance providers will cover. But it's cost effective for a provider to cover something that costs a couple $100,000 rather than pay for a lifelong care for someone or that end stage care, okay? This saves a lot of money. We have seen clean arteries. We have seen increased muscle mass, definitely for people over 65, several persons with the myostatin inhibitor. Your immune system is sort of your first line of defense, okay? So we want to go in, boost that immune system so that it catches cancer every time. What's normal is for science to solve this next problem, and that's what we're about to do. We can actually take all of these small biotech companies that have great data, they have safety and efficacy on some level, and we can put them put their treatments into compassionate care use of with people who are dying and see if they work and come back to the US with their data. We can help catalyst a bunch of small biotech companies and create the platform that everyone's been waiting for at a fraction of the cost. So we're willing to do all of that work to help other companies succeed because we have to be in this together. Most of the innovation is happening with small biotech. It's not really happening with those big companies. So we want to be the catalyst to make sure that everyone succeeds and that we actually see these products. I mean, there's so much good science out there that people don't know about. We've got technology now that is powerful enough, and we need to get this through to people as soon as possible.